So next we're going to look at these hips. Now we are often sitting down in flexion a lot, and that can cause knee pain and that can cause other issues in the legs. So what we're ideally trying to do is open up this area, also to prevent lower back pain as well. So I'll get started with about 3 exercises that you can do on a regular basis before you work out, on a daily basis just to feel better, and or to incorporate it into your daily training plan.
So firstly, we're going to do a rectus femoris release by foam rolling. Now it's so important to do this because it flexes the hip, extends the knee, and it can cause impact on the anterior pelvis tilt, can cause back pain, knee pain, and hip pain. So you're simply going to lie on this, and it sounds simple, but it's actually quite intense. Find the middle of your thigh. Okay, and from there, find a sensitive spot. You can either flex or point your foot to make it more active, and you can roll up and down. Rolling up and down, another option is to bend that leg and straighten that leg on a spot that you find particularly sensitive. Spend here a good amount of time releasing off. It can also impact you when you have tight quads to your SI joints, so this is a great help for anyone suffering SI pain. Bringing you the next exercise. So now we're going to look at releasing the abductors. The abductors can become often overworked, especially if we have weak glutes. And then it can cause groin pain, knee pain, hip pain, and lots of other issues. So it's really important to release this area out. So a great way to do this is to come into a lunge. And from this lunge, keep your feet first forward, and you're getting a nice stretch. From there, you rotate and you come into a hip flexor lunge. Squeeze your glutes and pull your heel back. And then you stay here a moment before rotating back. Making sure when you rotate back, your feet face forward. Then you will change sides. Making sure you squeeze your quadriceps, squeeze your glutes, engage your core. Okay, they are still active as you rotate. Here you are squeezing your glutes for the extension. You are pulling through the heel for a deeper stretch in the movement. Then coming back up. And do around 5 each side, pausing in each motion, making sure your feet are facing forward when you're in this side lunge, and then rotating your feet in this lunge as well. So all too often these glutes are underactive and they're not activating enough, and that causes instability in the hip area, can cause knee, ankle, and hip pain, but it can also lead up to the upper area into your shoulders, causing a non-tracking of the shoulders because you're impacted by the inability to stabilize down low. So let's activate the glutes by doing a half skater lunge on an elevated surface. Now when we do that, there's important things to note. If you cannot balance, use a wall. You're going to start here, and from here you're going to take the leg behind you. Your arms can be wherever you want. And that leg is going to cross the other leg. You're going to pull it up, so you're going to really lift it up and wrap it around. And you go down until you touch the ground, and then from here squeeze this side glute and come up. If you have reasonable balance, you can use a tap here, and then coming round until your foot touches, tap, find your balance, and then push yourself back up. If you are finding that you have great balance, I'll show you also from the behind, then you don't have to tap down. So you're bringing the leg around, pulling it up, so you're really squeezing that inner thigh, lifting it up there, pushing it forward and diagonal as you go down, squeezing that other knee onto it as I'm doing it. And this glute here is activating, so I'm taking it really slowly just so you can see. And then I'm going to use this glute muscle here to pull on up. So normal speed. So it's not too fast, but it's not too slow. And you will want to do between 10 and 20 reps each side. So really squeeze it up.